Assalamu alaikum. This is the Popliteal Fossa anatomy. In this presentation, we will describe what is this Popliteal Fossa, what its borders, what its content, and some few points about the like a clinical application. We will start now with the Popliteal Fossa borders. Now, Popliteal Fossa, as you can see, let me do the laser. So this is the popliteal fossa here. As you can see, this is the diamond-shaped area. It's located on the posterior aspect of the knee. It is the main path by which all the vessels and the nerve pass between the thigh and the leg. So it's a kind of a transition between thigh and leg, and it is behind the knee. Now, if you look to the borders, the popliteal fossa, diamond shape, have four borders. These borders are formed by muscles of the posterior compartment of the leg and the thigh. So starting superior-medially, and the superior-medially, like this is in yellow, you can see the semimembranosus muscle. The superior-lateral border, you can see the biceps femoris muscle and tendon. Now, on the inferior aspect, we can see infero-medially, we can see the medial head of gastrocnemius. On the lateral side, you can see the lateral head of gastrocnemius plus a small muscle here is called the plantaris. Now, plantaris could be deeper to the gastrocnemius, just behind it, but it's help in forming the lateral boundary, inferior lateral boundary of the popliteal fossa. Now, the floor of the popliteal fossa, the floor is formed by three structures, 1, 2, 3. Now, the first one is the popliteal surface of the femur. So it is bony part. The second part is the posterior surface of the knee joint capsule. So it is a ligamentous part. Now the third part of the floor is by fascia of the popliteus muscle. Now all these will form like a floor where all the structures including nerves, arteries, is actually passing on this floor. The roof is made up of two layers. We have the skin and we have the popliteal fascia, which is a continuation of the fascia lata or the deep fascia of the thigh and the leg. Now, content of the popliteal fossa is actually neurovascular structures entering and leaving, as we mentioned, the leg. It's from medial to lateral, popliteal artery, popliteal vein, popliteal nerve. And then we have another nerve just on the extreme lateral. It's called the common fibular nerve, or sometimes they call it common peroneal nerve. The tibial and the common fibular nerves are the most superficial of the content. So nerves here are superficial. They are both branches, of course, of the sciatic nerve. The common fibular nerve follows the biceps femoris border tendon, traveling along the lateral margin of the popliteal fossa. Now, in the popliteal fossa, the deepest structure is the popliteal artery. It is a continuation of the femoral artery, and it travels into the leg to supply it with the blood. There is a small vein called the small saphenous vein, pierces the popliteal fascia, or pierces the roof, and passes between the two heads of gastrocnemius to empty into the popliteal vein. A very common problem that happened in male and female, mainly in females, called Baker's cyst. So what is Baker's cyst? Baker's cyst, or the popliteal cyst, refers to inflammation and swelling of the semimembranosus bursa. There is a filled fluid sac found in the knee joint. Okay, so it is in the semimembranosa, so it is mainly where it is on the medial side. Okay, they usually arise with associated with arthritis, maybe rheumatoid arthritis, osteoarthritis, and can give you like a swelling in the popliteal fossa. This is a very common swelling of the popliteal fossa. Of course, you can decide, again, you can see this very obvious when the patient stands. So standing is the uh, examination position for this patient, and then you can see they start to bulge, the sac start to bulge and to go um, to be more prominent. It could be resolved by itself, but sometimes it needs treatment. Thank you very much. That was the popliteal fossa. We described the borders, we described the floor, the roof, and the content of the fossa. Thank you.